Good morning, everyone. This is Dr. RJ Rivera, and today we're going to talk about two of the most common nursing assessment in psychiatry, which is the CIWA and the COWS. So both are being used in a hospital setting and in a drug and treatment rehabilitation centers. So technically, this is also included in the 3 or 4 hour long nursing assessment in psychiatry that I've been providing some of the colleges and universities in the Philippines, as well as one of the 7 webinar series for psychiatric nurses, registered nurses in our country. So ano nga ba yung CIWA or the Clinical Institute Withdrawal Assessment for Alcohol? So it is being used to assess the physical and psychological symptoms according to severity. So again, if a client or if an individual is drinking excessively or struggle with alcoholism, always remember that they're still, they're human, so they need help. So that is the reason that the CIWA is an important assessment that nurses utilize in order to help or to assist these clients in terms of the withdrawals. Second, it is for nurses to know how to medicate based from objective data. So the next one, the agitation, anxiety, auditory, visual, tactile disturbances, clouding of the senses, headache, nausea and vomiting, sweats, and tremors are actually the areas that we checked utilizing the CIWA scale. So technically, ito yung mga symptoms o mga simptomas na nangyayari pag ang isang tao ay nagsastruggle ng alcohol withdrawal. So again, if you imagine, paano magbabago ang isang individual kung nagsastruggle siya nitong mga simptomas na to. So as nurses, we need to make sure that we're helping this client to attain not only sobriety, but also long-term improvement. Because as we all know, alcoholism has its own consequences too. So, and also just a reminder that even though they have this bad habit, not only they are still humans, but also they deserve to be respected. So as you will notice, your clinical instructors, professors, or the dean might give you some activities that you need to utilize this specific CIWA skill. So that's the reason that I'm conducting this short webinar just a walkthrough video for you to be able to know how to utilize it and have that feel that you're in a hospital. So it's actually a one-page paper na back-to-back, but for today's webinar, um, I just want to show you both at the same slide. So if you noticed, the symptoms or the withdrawal symptoms are the one that we're checking. So first is nausea and vomiting, anxiety, and then sweats, disturbances, tremors, agitation, orientation, and then headache. On the other part of the slide, you will notice on the top portion, you need to write the date, the time, pulse rate or heart rate, respiratory rate, O2 sat, and blood pressure. So the vital signs, usually it should be done every 2 hours or 4 hours, but again, it depends with the hospital protocol. So, bakit siya importante? This is important because for the first 24 hours or 48 hours, the client will struggle with withdrawals and a lot of changes with their vital signs. So that's the reason we need to check it. If you notice here, it says here assessment protocol. You need to do the vitals, and then there's some if the total score is, for example, 8, you need to do the vital signs every hour. So it's very specific, it's very detailed, um, and you're able to follow through with it. So if you notice this one, ito yung mga symptoms ng withdrawal, alcohol withdrawal. So we need to rate it from 0 as none to 7 as the most severe one. So for example, we're gonna go back to the other side. So yung nausea and vomiting. So, for example, you're seeing AB, yung client natin, constantly nagsusuka siya or nauseated siya. So, you're gonna score it at 7. Or if you wanna, hindi mo naman siya na-notice na nag-vomit and nauseated, you can ask the client, so, do you feel nauseated? Para ka bang nasusuka? Para ka bang mag-throw up? And then you can even have them rate it from 0 to 7, and that is the answer. For the anxiety, what I want to point out here is aside from them telling you the rate, you can always check also. You can also rate it as how you observed it. So, for example, client is yung lakad siya ng lakad, di siya mapakali, um, um, sobra siyang restless. So you can always rate it as 4, 5, or 6, and it is the same thing as with agitation. Another one is for sweats, paroxysmal sweats. So if you're the nurse, the duty nurse, and then notice mo na para siyang, alam mo yung after basketball game, yung drenching sweat, yung tumutulo yung sweat. That is what we call yung drenching sweats, or number 7. And or if you notice para siyang may beads of sweat lang sa forehead, it will be number 4. So, for example, di ba, if we need to do defecate, we need to do number 2. And then, sobrang kailangan na natin mag-restroom. Sometimes you notice na parang may sweaty na yung forehead mo. So, yun yung beads of sweat. Orientation, you may want to ask the client, so ano bang araw ngayon, anong date ngayon, sino ka, and all that, and then rate it depending on their answers. Headache is also actually the same as nausea and vomiting, in the sense that you can always ask them about it. So masakit ba yung ulo mo from 0 to 10? How can you rate that? The tremors, sorry, I forgot this part. The tremors is actually an assessment that you can do by having them extend their arm and spread their fingers, and then you will check if meron siyang noticeable tremors. So, 4 as moderate with patient's arms extended, and then 7 severe. Yung kahit hindi mo na siya in-extend, meron siyang tremors. And lastly, for tactile, visual, and auditory disturbances, there are specific questions that you may want to ask the client. For example, have you experienced any itching, pins and needles? Para bang may tumutusok sa paa mo? Or para bang may bugs na nagcurl sa skin mo? For visual disturbances, so medyo sensitive ba yung mata mo sa light today? And internally stimulated ba yung client, which means parang meron siyang nakikita and all that. And then lastly, for auditory disturbances, you may want to ask the client, are you more aware of the sounds around you? Are they harsh? Para bang sobrang overwhelming sa'yo yung konting ingay? Do you get easily startled? So again, these symptoms or symptoms, ito yung mga symptoms na nasa-struggle ng client mo if they're having withdrawal. So just imagine paano sila magbabago, paano sila mag-initiate to be sober and to continue sobriety kung nagsa-struggle sila. So I have a lot of clients who tells me na, oh RG, paano ako magbabago every time I try? Ang sakit ng ulo ko or nagsusuka ako, mas lalo akong non-functioning. So how can I even myself expect to change if I'm struggling? So that's the reason that that we use the CIWA scale to help the clients, to assist them in terms of, again, sobriety and long-term improvement. And as you all know, during the lectures, during your lectures, in your maladaptive behavior, um, Addiction, alcoholism it's not just a learned behavior. It's not just a lifestyle choice. It's also because of genetics. It can be hereditary and also some chemical imbalances in our reward system of our brain. So that is the reason that as nurses, as much as it's hard for us to um, not give our opinions or not give our insights, we need to always work in a non-bias with a non-bias attitude, and always focus on our clients and their recovery. Another thing that I want to show you guys is the COWS, or the clinical withdrawal opiate skills. Again, I just want to remind everyone that some of the activities that your clinical instructors, RLE coordinators, dean and nurse faculty, some of the activities might include you doing the cows and the CIWA. Um, Going back to the CIWA, um, if you noticed, sorry, I forgot it. If you noticed on the lower portion, so you're gonna add yung score, write down the total CIWA score, and then it depends with the score if you need to give the client some medication. It's either the diazepam or the lorazepam. Again, the CIWA score, um, depending with the hospital, the CIWA or the alcohol withdrawal scale, we use it in conjunction with alcohol protocol, which means yung alcohol protocol, yun yung mga medication naman na we can use depending with the score. So that is the reason super importante ang CIWA, and that is the reason you need to be aware of, and to learn how to use it. If you notice this portion, indication for PRN medication, so again, that's the reason that assessment is very, very important, and then the scoring is also important. And then at the bottom, you need to sign, put your initial. For me, it's AR. And then usually the doctors or the on-duty psychiatrist will also check on this part, because that will give us the insight if the client is doing well or not. Um, So another thing that I want to show you guys is the COWS, or the clinical withdrawal opiate skills. So it is measuring symptoms for opiate withdrawal. It is also monitoring symptoms improvement over the course of treatment. So basically, you will notice that the withdrawal symptoms is kind of similar between opiate, yung narcotics natin, heroin, cocaine, fentanyl, Percocet, morphine, Dilaudid. Ito yung mga opiates na tinatawag, or narcotics. So yung withdrawal symptoms is quite similar to yung CIWA natin, or alcohol withdrawal. Meron silang distinct symptoms, but same protocol, which means you're gonna check yung withdrawal, and then total the number, and then we follow the COWS protocol, which means ano yung mga medication that we can give to the client, depending with the total score. So I want to show you this one, guys. So again, the CIWA and the COWS and their respective protocols, or the medication again, the varies from one institution to another. So we follow different policies, but in general, um, this is how it looks like, the cows. So you check the resting pulse rate, sweating, restlessness, pupil size, bone or joint ache, runny nose, GI upset, tremor, yawning, anxiety, and goose flesh. So again, meron silang similarities, meron lang silang distinct symptoms. For example, with opiate withdrawal, most common yung runny nose, joint pain, yawning, GI upset. So what you will do is, again, rate it, put your answers here, And then also, that's the reason that if you noticed, per symptoms, meron siyang kaakibat na question kung paano mo siya i-ask. So it comes with practice to be able to be expert in doing this one. But again, I just want you to be familiar with it, like a good to know or a need to know assessments in psychiatry. Similarly, with all the drug addiction, alcohol addiction, again, we treat the client as human beings. They deserve to be respected. They have their own human rights, regardless if they regardless with the consequences of their actions. We need to make sure that we're working as a nurse. We provide compassionate care. We provide non-biased care. We set aside our own differences, opinions, and lastly, we do what's best for them and how you want our so treat them as how you want our parents to be treated. So basically, those are the two that I want to discuss today. Because technically, the 3 or 4 hour clinic um, nursing assessment in psychiatry training program is already full. So I won't be able to discuss this to everyone. But I just want to share this to you guys, and feel free to show it to your students. So thank you and have a nice day.